Hello everyone and welcome to the iJet webinar, iJet 2017 Global Health Outlook. My name is Erica Sante and I will be moderating this webinar. Today we'll take a look at the top 5 big health events that iJet will be monitoring in 2017, how they will likely impact your people and operations, and discuss what you can do to mitigate disruptions. Our guest speaker today is Catherine Harmon, Health Intelligence Expert and Senior Director of Category Intelligence here at iJet. Catherine has been with iJet for more than 6 years. She leads the iJet Health Intelligence Team as well as the Category Intelligence Team comprised of Environment and Transportation Intelligence. Catherine's health team maintains a robust database of global health issues. The team alerts and focuses on a broad array of health concerns that may impact business and travel around the world. Catherine practiced occupational and internal medicine for over 14 years as a physician's assistant and has an undergraduate degree in criminal justice. Good afternoon, Catherine.
Hi, thank you, Erica.
I'm going to transfer controls to you now so that you can drive.
Wonderful. Yes, thank you everybody for attending today. I hope the presentation you will find engaging and somewhat enlightening. It's probably going to be a little bit different than what you might expect it to be in terms of the focus of the different sorts of risks that I see as being prominent, especially for businesses and organizations throughout 2017. All right, so today for the agenda, we're going to go over a global perspective on what the different health threats might be, and how these might impact business continuity or your organizational preparedness. Talk a little bit about the evolution of Zika virus, because that's still on a lot of people's minds. The rise in vaccine-preventable diseases is also something that is showing pockets of epidemic activity throughout the globe. Food security issues are going to be big with climate change and the GMO controversies and many other issues regarding food around the world. Also, geopolitical instability and healthcare availability is pretty big, with a lot of internally displaced persons and movement of people and migrations around the world. They can carry various diseases with them that may not have been taken care of and certainly infect a novel population. Also, what about aging populations and your organization? New data on dementia and Alzheimer's disease and an aging workforce is really going to play heavily into human resource roles and your business practices in terms of fitness for duty. And it's something that organizations really haven't thought that much about, but probably need to. And lastly, we'll talk about what your duty of care imperatives are and some mitigation strategies to help you navigate through some of these risks and threats in now and for the foreseeable future. Okay, so going to the global range of threats, we can see that over the years there have been and continue to be a variety of threats that can affect travel and business operations. Among the most publicized are those that involve political conflict and terrorism, security issues, as well as natural disasters. Business continuity plans and security processes continue to be at the forefront of managers' minds, and continued involvement in reshaping plans to meet the ever-changing operational environment are crucial. Natural disasters pose a myriad of health risks, something all too often put on the back burner of planning efforts. Aside from obvious trauma-related injuries associated with many types of natural disasters, infectious diseases can occur with many of these events. Also, mosquito-borne disease and waterborne illnesses are some of the biggest threats facing people in and around a natural disaster. As typhoons and hurricanes give heavy rainfall, flash flooding, heavy snows that melt in the spring can stir up all sorts of different diseases in the soil where they remain dormant and then become a public health risk. As we become more exposed to all of these types of events, our knowledge base grows and our ability to mitigate improves. And so post-disaster health issues can be mitigated just by understanding, what to look out for. Okay. So in the last 6 or 7 years, many health events and crises have made international headlines and had a significant impact on operations and travel. From the pandemic flu to radiation concerns and red herrings such as Ebola and the prominence of mosquito-borne diseases, organizations have become much more savvy about health risks and the importance for pre-planning, prevention, and mitigation to protect their people and assets have grown. Zika virus showed the complexity and ever-changing environment of human disease risk and the various complications that can be carried along with health concerns. For one of the first times in recent history, being knowledgeable not just about the disease and where it was a threat, but to whom specifically and how mitigation might interfere with EEOC laws and disability rules. Despite the biggest risk of complications in population, restrictions to travel and continued business could not be enforced on only a defined subset of charges. As Zika virus spread, eventually to U.S. shores, businesses who did not fully involve all parties and employees found themselves in a quandary of how to deal with such a complex health and legal issue. Okay. Hang on, apologies here. Okay, as you can see, a variety of factors can adversely impact an operation, both in terms of safety and security as well as cost. Many travelers away from home on business, education, or pleasure frequently find themselves in situations beyond their control. Ensuring that your traveler is armed with the best information and processes can mean life or death. Understanding that your organization is ultimately responsible for that person is an interpretation of duty of care acts and legislation. Having policies that are frequently reviewed, updated, and understood among all stakeholders is paramount to safe and secure travel and operations. When events, circumstances, and company policy for those going abroad is becoming more and more important in meeting your duty of care obligations. Okay, so Zika virus. Is Zika virus still a threat? It was big news back in 2016, and then we started hearing less and less about it. We started hearing about case declining and what's called an epidemiological curve. And if you, in this slide, you can see that in Colombia, disease peaked, during the first part of last year and then started to wane off. But these are reported diseases from the local population. Reduced transmission and cases does not equal a reduction of risk because novel immune systems have not been exposed to Zika virus, and people who are traveling from areas where Zika was not prominent and is not what's called endemic are still at risk and will remain so. So it caused quite a ruckus in 2016, impacting many travel plans, causing businesses to reconsider how they enforce organizational policies on travel safety and security. Millions of cases of Zika virus were reported in more than 75 countries globally, the vast majority being throughout the Americas. Believed to be spread from the South Pacific Islands in 2014 to Brazil and subsequently spread northward, Zika caused trip interruptions and significant concerns. The timing could not have been worse, with the epicenter of the epidemic occurring in and around the 2016 Olympic venue, and this caused many people to reconsider their travel. We're seeing fewer and fewer reports about Zika virus as both the novelty is worn off. Many organizations have put their policies and processes in place. Case counts have diminished, and the ever-present risk of transmission and adverse effects of the disease have slowed. But Zika virus will remain in the mosquito population in these areas that reported significant case counts and where the vector, the Aedes mosquito, has become prominent. It's an endemic disease in a lot of these countries. This is a disease that can be supported and perpetuated by the survival of the pathogen, in this case mosquitoes, and their ability to infect anything and anyone whose immune system has not been exposed or developed antibodies to this virus. So getting bitten by an infected mosquito can still cause disease in that person, even if reported cases in that area seem to have, greatly diminished. Travelers may get a false sense of security about some diseases. The less we hear about them or the less we see them causing problems in one area, the less we consider our risk of exposure to that disease. But in many locations throughout the Americas, Zika virus is going to remain, even though these case counts seem to be at the lowest. So people who are planning travel to these areas, even though we're not seeing the news reports, you still need to be aware and savvy of the risk and plan accordingly, being fully informed, of what's going on. All right, so in 2017, we're going to continue to see travel-related cases. Because Zika virus has been reduced in many areas, funding to combat and research this disease will continue to decline in 2017. The risks to travelers to endemic areas is still very real, as I just mentioned. Vaccine development is in its infancy, and many of the locations that have seen the highest number of human cases, largely underreported, are prime locations for the mosquitoes that carry Zika virus to proliferate. Long-term expats either have or will become exposed and develop a natural immunity. This contributes to the decline in cases reported. People who come from other areas do not have that immunity and are at risk of developing disease. Recall that only about 1 in 4 people who have Zika virus will develop symptoms. Therefore, continued risk of spread through global travel will remain, and we all need to be vigilant about this disease. In 2017, locally acquired cases will continue to diminish with less reporting, testing, and naturally occurring immunity. However, travel-related cases will most likely hold steady. People going to these areas will still need to be educated about the virus and their risks, and policies restricting travel should still be maintained. So don't be fooled by some of the declining case counts that you're seeing. All right, one of the next things to look out for in 2017 is increased cases of vaccine-preventable diseases globally. And we have an iJet poll question to see, how you feel about it. Do you know your immunization status, either from childhood or travel vaccinations? We'll give you a moment to respond.
All right, Catherine, I'm going to launch that poll now for everyone.
Okay.
This is a yes or no question poll.
Yeah, and I know, from my childhood, vaccination records are just not accessible. I'm too old to be in, the electronic system that most departments of health have now, and I just had that little vaccination card that my pediatrician gave me, which I no longer have. So, it's almost a best guess. And if you think that you're at risk for something, then getting re-immunized certainly won't hurt.
All right, and I'm going to close the poll and share the votes. It looks like it's showing about 69% saying yes and 31% saying no.
Okay, it's excellent that people are aware of their vaccination status, because that puts you at less risk of developing a disease if you're exposed to it. For people who don't know what their vaccine status is, there are things called titers. It's a simple blood test that your physician can perform to see if you have either a natural immunity to certain diseases or if you've been vaccinated appropriately and your body is completely protected from getting exposure to some of these what we call old world diseases or childhood diseases and things, because they are most common in the pediatric population. What's The rise of vaccine-preventable diseases is going to be problematic, especially in 2017, as we're seeing more and more outbreaks of measles and mumps and pertussis or whooping cough in areas where we really shouldn't be seeing them. Despite wide discrediting of Andrew Wakefield, no longer licensed to be a physician, and retraction of the publication that attributed vaccine to childhood autism, there's a very large growing faction of people who are called anti-vaxxers, people who are against the policies of vaccinations. Largely, this is out of misguided fear of severe neurological complications and adverse reactions to these immunizations. Vaccines work by delivering enough of a killed or live pathogen to a person to stimulate that body's response in combating that disease, so that exposure to the pathogen will not evoke a response. You won't get sick from that particular strain of virus or bacteria that you were immunized against. Vaccines are developed and produced to combat a myriad of health risks, especially those that have shown a high incidence of case fatality or debilitating illness or injury when acquired naturally. Although not all vaccines are right for all people, because you may have individual health conditions that will prevent you from receiving a certain vaccination, people can receive most vaccines safely without risk of adverse reaction. Another reason medicine promotes the use of vaccines is for something called herd immunity. When more than 83% of a population is immune to a disease, either through natural acquisition or from vaccinations, there's a significantly reduced risk of transmissibility in that population. To err on the side of safety, public health authorities feel that it requires at least 94% immunity before a population is protected against a disease. This means that either 94% of all people in a country need to be vaccinated or would have previously had a disease in question for there to be a significantly reduced spread of this disease. Below 94%, the risk goes up, and anyone exposed to a disease in question who has not been protected from it may contract this disease. Traditionally, impoverished areas have the highest rates of vaccine-preventable diseases, largely because their vaccine programs suffer due to lack of funding. Aid workers, lack of a tracking system to ensure all patients received an entire series of vaccine, because sometimes one shot may not do it, and you need 2 or 3 in order to develop full immunity to it. Under-vaccinated persons, are posing a risk, and funding issues, have prevented adequate protection. Over the past decade, growing populations, often centered around certain communities due to shared values and beliefs, have declined vaccines for various reasons. With increases in global travel, those under-vaccinated populations and people refusing vaccines are beginning to meet with more frequency, and then this disease that could have been prevented through an immunization program are starting to make a comeback. Measles epidemics, which was all but an eradicated disease a few years ago, are popping up more and more. In 2016 in the United States, 16 states reported measles outbreaks, 46 states reported mumps outbreaks, and though the 2016 data is not available at the current time, in 2015 there were more than 20,700 cases of pertussis, or whooping cough, in the United States. This is a disease that can be kind of mild in adults, but deadly for infants who are not protected. With 6 deaths from all 50 states and D.C., pertussis is really something that we need to be aware of. Vaccine-preventable diseases are not innocuous and should not be dismissed. Once hailed as routine childhood illnesses, reports of permanent blindness, deafness, and neurological problems from various viruses and bacteria are problematic. As mentioned previously with Zika, until we develop an immunity from safe exposure, there is definitely a risk for people who don't have a full immunity to it. For travelers who have not had a chance to develop immunity because of lack of exposure, visits to a clinician prior to leaving for your trip are really, really important in an effort to assess what your risk is and consideration of ways to prevent risks of certain diseases. Remember though, immunizations are not immediately effective. You need to give your body time to develop antibodies to a disease before you risk exposure. That means seeing a provider well in advance of your departure and possible exposure to something. And if you're a frequent traveler to many different destinations, consider talking to your healthcare provider about upcoming last-minute travel and being prepared for future destinations. Not only will you keep yourself from becoming ill and ruining a trip, but you'll also protect your friends and family from a novel disease threat. If you're concerned with the vaccine in question, talk to your provider about alternate formulations that can be just as effective but not contain preservatives or additives that are typically put in to boost effectiveness. So it's really important to remember, as is very common with the flu vaccine, many people believe that they get the flu from receiving the flu vaccine when in reality it just didn't have time enough to work really well. So if you get your flu shot and you're exposed, in that first 10 days to the flu, you're probably going to get the flu. And it's not from the immunization, and it's just that your body has not had a chance to develop immunity to it yet. Okay. So what about food security challenges? We've got another poll for you in perceptions on food, foodborne illnesses and security. So how do you feel about organic foods? Are these less likely to be contaminated? And that's a true or false question. Okay.
We'll give it about 30 seconds. We're at about 10 seconds now.
Great. Yeah, a lot of people are moving to organic foods, and these are really wonderful alternatives to a lot of chemical additives and preservatives and things, but how safe are they really? And what is the impact going to be in 2017?
All right, I'm going to share the results with everyone now, and it looks like about 25% voting true and 75% voting false.
Okay, so it's really important to understand what your food risks are, whether you're home or traveling, because you have to remember, in the United States and other countries, a lot of food is imported, and although much is inspected, there's a lot that just can't be. People do what's called a random sampling, which is, if you have a crate of food that's being imported from another country, they'll pick one or two cases, of these out of a massive cargo container to inspect, and if those pass muster, then it's just assumed that the entire shipment is okay. Food security also doesn't just encompass the foods, that we're eating, but what is the global outlook on food going to be? We know that in a lot of nations there's food insecurity, and even in a lot of developed nations, poverty and rising costs and economic conditions are causing more and more food insecurity. That is, people that just aren't getting enough to eat or enough of the right foods to maintain good health and prevent chronic preventable diseases. Rising costs and climate change have a big impact on our food supply. Low-cost food options are going to begin to dwindle. All these agricultural challenges are going to create supply shortages. It seems like this is a funny thing for a health forecast, but when you stop to think about it, availability of safe food is a real issue globally. Whether it's foodborne illness from improper preparation, or simply a lack of sufficient food availability to sustain a population, significant economic and geopolitical strife can emerge out of food issues. Climate change is negatively impacting crops and livestock globally and raising many issues surrounding alterations of food crops for consumption. That is, what we call a GMO food is also presenting challenges. price controls surging populations are reducing overall availability of food in many areas. Supply is often falling short of demand and causing stress. Those most at risk for food insecurity are developing and impoverished nations. Severe droughts, floods, disease affecting plants and animals, and other disasters, both man-made and natural, are affecting food supply. Developed countries have shown an over-reliance on processed foods and protein-based diets in the last few decades, and chronic health issues are beginning to mount, such as diabetes and cardiovascular conditions. The move toward organically grown produce and meats also has its share of challenges. As we move more toward free-range livestock, away from antibiotic administration and other medications to boost the livestock yield, we'll see decreasing in availability and prices rising. Additionally, to what will be a surprise for many of you, organic foods are more prone to diseases and harmful pathogens in their growth and packaging, enhancing the risk of human disease. Studies have shown that organically grown foods have 8 times the risk of E. coli and other harmful pathogens like Listeria than our processed foods. That doesn't mean that organic food is bad. Please don't get me wrong. But what it means is that, you know, we need to be promoting further education, you know, on how to handle these foods safely, you know, cooking and washing, especially as a shift in culture grows toward wanting more organically and naturally grown foods. These organically grown produce and natural meats are important for healthy lifestyles. People should be reticent to consuming unpasteurized dairy products and make sure that you wash your produce fully and cook meats completely in order to prevent a lot of these foodborne diseases and contamination. So what about natural disasters and their impact on food supply and human security? The scientific community believes that there is a direct link. Increases of natural disasters of more than 80% have been shown in the last couple of decades. Between 2001 and 2010, more than $1.2 trillion in losses were attributed to natural disasters. Although much of this was secondary to increase of population globally that was affected and urbanization in areas prone to flooding and massive storms, the loss is still enormous. Food needs to areas plagued by disaster, as well as direct losses of crops and livestock, will continue to escalate in 2017 unless proactive measures are taken to secure agriculture. So, you know, in a sum, we've got rising costs of food, often reduced supply and availability of food caused by the impacts of climate change and increases in natural disasters wiping out crops and livestock, moves toward more organically grown foods, which sometimes can carry harmful pathogens unless we prepare them properly. Changing diets and people, you know, who are developing more chronic diseases based on their dietary selections, becoming more and more problematic, and all of that is going to impact business and travel because, you know, your employees and your travelers, you know, may fall ill or develop chronic health challenges, which will be costly to organizations. All right, so what about geopolitical instability and the health-related challenges we mentioned at the beginning? You know, I'm curious to see how people feel about that. Do you believe that a country's security issues are unrelated to national health concerns and care availability? True or false?
Okay, giving everyone about 30 seconds to answer.
Great.
All right, and I'm going to share results with about 9% voting for true and 91% voting false.
Okay, great. I'm glad that people, are aware of this, and that health concerns are very prominent in areas that are undergoing conflict, or open war. Um, the UN High Commission on Refugees is estimating the number of projected displaced persons for 2017 at more than 1.2 million globally. That's a lot of people, who will be considered refugees or having to move because of conflict. Record incidents of conflict and crises across the globe have caused massive mobility for people. And they're leaving areas that are considered not safe for habitation. When people move unexpectedly, infrastructure may fail in supporting them in their new location. Goods and services that an area had planned for may only have encompassed or been accounted for the local population, and surges, of an influx of people with an undetermined length of stay can really wreak havoc, on the medical infrastructure. Vaccine shortages will continue to occur in areas of extreme movement and fluctuation because vaccines take a while to produce. They're not just instantaneous, and for a country, estimating the need for just so many, and then suddenly there's, a 500,000 people more that have arrived in there, often are going to fall short. So vaccine programs have fallen into disarray in a lot of areas, where conflict is occurring, and this makes refugees vulnerable to various pathogens that were once under control. Syria is a great example of this. Syria has suffered a total collapse of their health infrastructure, and there aren't records anymore of who received what vaccine or, what people were being treated for. And many of the refugees, who have moved out of Syria and into areas of Europe and other locations throughout the Middle East, just, aren't aware of what their vaccine status is, or what they're immune to, or, they may not be. So continuous movement by population makes preventive measures for disease control a real challenge, and a lot of people are going to become under-vaccinated. As you move from one area to another, the refugees come out of their areas of conflict, and they may encounter aid organizations who are doing a really good job of giving vaccines to people, who come into camps and things, but then these people may move on before they get a second or a third dose of the vaccine that they really need to protect themselves. And then those records, again, kind of get lost in the shuffle. Countries who aren't planning for massive migration are going to fall short in their supply, as I mentioned, and the expense of maintaining a stock of what-if vaccines, is often out of a nation's reach. Vaccines can become costly, and the budgets may not be prepared, for an influx of holding on to something, just in case they need it, and then it expires and they have to discard it. In addition to vaccine-preventable diseases, other ailments known to plague people living in less than optimal circumstances and in crowding include tuberculosis, skin diseases, and acute diarrheal disease. This can occur in a wider population, causing outbreaks of diseases not typically seen in a new area. So countries that just don't see cholera, or have a really good tuberculosis program, all of a sudden these case counts are going to rise in some of these illnesses and pathogens that they haven't seen in a long time because of new people, in poor health because of leaving areas of conflict. Health-related crises are not limited to people, however. We're going to see an increase in animal disease, and some transmission, can be shared with people. So it's not just confined, to some of these animals, but then again, animal vaccination programs and having adequate food, their food security challenges and things are going to cause a lot of disease in in these animal populations that were once relied upon for farming and food and other agricultural purposes. Access to safe feed and medical programs will diminish in areas of catastrophe, and animals will start foraging again, and possible health risks may ensue. Animal to human disease, will rise, and displacement for the human population will continue to occur. Reliance on any food source, including ill animals that can pass disease such as anthrax, will commence in a lot of areas. There were recently reported cases of people feeding off a carcass that had thawed from the tundra in Siberia recently. And anthrax is a disease that is normally found in the soil, can live for years and years and years in spores, and then infect the meat. And so rises of gastrointestinal anthrax will start to increase, globally in 2017. Outbreaks occur in herds globally, just on a natural occurrence. So it's not unusual when people, hear anthrax and they think about, bioterrorism and attacks, but in reality this is just something, that occurs globally. Herds get it on all continents, nearly all continents, and growing food security risks that we mentioned are largely predicated in local areas of conflict. Risk of transmission of this potentially deadly disease will continue to grow as people rely on eating sick animals or even those that have passed on from diseases without getting them tested because they're just desperate, for any kind of food. Okay. One thing that you probably is not on the minds of a lot of organizations is what dementia, Alzheimer's disease, and other diseases of an aging population, what effect is that going to have on your organization? And we have another poll question. I'm curious to see how many people are concerned about aging healthcare issues, either for yourself or for your family. So we'll give you a minute or so to answer this question. I know personally, I've had friends and family, battling dementia and Alzheimer's disease, passing away from it, in this past year, and it really got me thinking, and researching what are going to be the risks for the future and what impact does that have on an organization.
All right, Catherine, it looks like about 94% of our audience is voting yes, and about 6% have not thought about it.
Okay. Yeah, so the statistics are really pretty staggering. And again, you may be surprised to see this on the list of health crises for 2017, but too often we dwell on infectious diseases and forget about other health issues that can be equally catastrophic to an individual and is a growing problem. Statistics on dementia globally are staggering. Most of our data comes from countries that have a robust health infrastructure and collection repositories, and therefore the real extent of the global problem has yet to be calculated. But as our populations age through improved medical intervention and growing availability of longevity-preserving pharmaceuticals, we will start seeing a marked increase in reported dementia over the next few years. Baby boomers are reaching retirement age, but many economies are forcing them to stay in the workforce well beyond the expected years of work. Not many people are retiring in their 60s, in early 60s anymore. They're continuing to work well beyond the traditional age of retirement of 65. As we have an ever-growing aged population, we're going to be faced with the potential for some of these employees to develop some sort of dementia. Work performance, productivity may naturally decline as a result, but legally protective measures may need to be considered. It's best if organizations stay ahead of these possible issues by fully understanding their local employee protection laws and regulations and knowing signs of disease process to adequately handle employee issues. Don't let fitness for duty clash with age-related discrimination by not addressing the issue now. Awareness programs are on the increase. By 2050, it is estimated that more than 13.8 million persons are going to develop Alzheimer's or another related dementia, just in the United States alone, up from the current 5.2 million people afflicted now. Full-time workforce participation rates in the U.S. for those over age 65 has risen steadily over the past 5 years and is going to continue to rise. According to the United States Bureau of Labor Statistics, more than 13 million people aged 65 or older will be full-time employees in the workforce by 2022. More than half of these people are married. With the risk of developing dementia continuing to increase, one or more of your employees affected by this disease is also going to rise. Employees may need to take a hiatus from their positions to care for a spouse, parent, or other family member with dementia, and organizations should be prepared for the challenges an absence for family medical leave might propose. Generations of people who did not have access to long-term care options are now left to rely on family members to provide care and daily safety to their loved ones. As challenges in absence and cases of dementia increase in 2017, those needing assistance to care for the patients will also rise. Planning for burgeoning and largely unpreventable health crises of dementia-related conditions will serve to protect the continuity of operations in your overall organization. Age-related dementia is not the only concern, however. The next few years will see scores of people affected by traumatic brain injury in the workforce or returning to further their education. With increased awareness and diagnosis, the rates will continue to rise. TBI, traumatic brain injury, is a plague that in recent years has skyrocketed due to exposure to conflict, whether by profession or circumstance. As these people leave areas of conflicts and return home to the workforce or are refugees possibly impacted by war and civil strife, those affected by TBI will have their own set of challenges. Traumatic brain injury costs Americans more than $76 billion in 2010 in direct and indirect costs. 30% of the deaths in the U.S. have a component of traumatic brain injury. Accommodating health complications is going to be important for businesses moving forward, and an awareness of the issues faced by these patients is important for successful employee-employer relationships. Having stakeholders meet to develop fair policies related to dementia and traumatic brain injury will be important for 2017 and years going forward. For both TBI and dementia, the diagnosis is only one small component to the entire disease process. Often, increased rates of depression, anxiety, and other mental health issues accompany these diseases, and although these alone are often debilitating and under-recognized, in conjunction with another disease affecting cognitive impairment, they may be highly detrimental for the patient and the workforce. So I know that was a lot of information, on this, but in summation, organizations need to be cognizant of the fact that their workforce is starting to age. A lot of these people, have risen to certain levels within an organization, through the years, and you really need to be cognizant of the fact that their fitness for duty may start to decline, and how are you going to handle some of these things? Do you have a program in place, with human resources and other parts, other stakeholders within an organization to safely, securely move some of these people out of a position where they might no longer be fit for duty and into an alternative position without endangering yourselves legally through disability acts and other protective groups. So that's something that you really need to start think about because right now, 1 in 9 people in the United States over 65 have some kind of dementia. That's a lot of people, and most of the caregivers are shown to be family members and are unpaid for their care, so it's causing an economic disruption for them too, which may carry over into the workplace, through stress and their own sets of depression and anxiety. Impairment can also begin long before a diagnosis is made, and therefore, again, with fitness for duty organizations, need to be kind of aware. Everybody is forgetful, but if some employees are noted to be more so, or certainly endangering themselves, depending on the kind of work that they do, then they may need to be removed from that position and put into an alternative one. So developing policy, getting all the stakeholders together to figure out what you're going to do and how you're going to handle, some of these things with either employees needing to leave to care for aging family members or spouses, or developing the disease themselves, is something to consider now. Providing long-term care insurance that covers cognitive impairment will go a long way in making employees, feel safe and secure in their environment. All right, so business imperatives, we hear a lot about duty of care and what that means. So duty of care for your people in your organization extends to travel, so it's important in both the country, of origin, your home country, your base of operations, but also when you send employees out on business opportunities to travel, your duty of care needs to extend to them. And this is warning and informing them of any kind of risk that they may encounter depending on where they go, whether it's diseases, unrest, severe weather, these kinds of things, and staying up to date on a lot of these issues so that your travelers can be prepared and informed as to what their real risks might be. Risk mitigation is very important, providing consistent approaches for training, having immunization programs and health policies in place to keep them protected. A lot of travel is often last minute. And people, who see providers, often say, oh, I'm going to India tomorrow. And as we previously mentioned, it takes time for a lot of vaccines that need to be administered to work. So for the first, 10 to 21 days of travel, your people may not be protected against something that they were immunized against, like typhoid fever or yellow fever. And we're seeing a huge increase in yellow fever in Brazil right now over the last few weeks, and we're expecting to see that increase. Yellow fever is something that's endemic to Brazil. It's always been there, but it's what we call the sylvatic reservoir, that is, monkeys have it, and they continue to perpetuate the disease through the mosquito population. But the spike in human cases is kind of alarming, and largely that's, again, because of under-vaccination efforts. So, having protection against yellow fever, a lot of countries are very strict on you entering in there if you have ever had the chance of exposure, and they do that on a country basis, not on a local basis. Having that protection ahead of time, can save you from a lot of headaches. Some countries will detain you for 10 days, vaccinate you on the spot, and these are some places where you may not want to receive your vaccination. So understanding all of these risks in advance and planning ahead is very important to the protection of all of your people. Knowing that there's a hotline that people can call 24 hours a day, 7 days a week for support and assistance to help get them out of sticky situations, or even just to answer questions related to some of the areas they are, is very important for your duty of care. And an ability to respond quickly resolving any kind of issues, whether it's medical or security or travel headaches, due to weather disruptions or something, is also important in meeting your duty of care obligations. So in terms of health, the value of health intelligence for your people and organization, will meet a lot of those duty of care needs, because it's been shown that people will get sick during travel a lot more often than they'll get shot at. So what we do is we look at health security holistically, and help organizations interpret impacts of complicated and emerging health threats. So health security is not just about infectious diseases, as we've gone over this webinar. It's about a lot of other issues as well, and national capacity to deal with these issues. So some nations, some countries are just better adept at dealing with mental health issues and dealing with environmental health threats, sanitation and water quality, food quality and inspections, a lot of different things that we take for granted in some areas. Other countries, may have significant challenges are. So knowing what all of these risks are, whether it's what the doctor-patient ratio is, what hospital beds are available, what training and certification requirements exist in certain countries, knowing all that can help mitigate risks associated with duty of care requirements and provide peace of mind for your people. So it's not to say that areas in red, that have a very high risk of health complications or meeting basic health needs are areas where you shouldn't travel. It's just being aware and fully knowledgeable of what those risks might be, whether it's just lack of hospital infrastructure, as seen in Syria, or frequent outbreaks of disease that can be prevented or mitigated through vaccines or medication, or even just travel health kits, or awareness to avoid certain areas and situations. This is what health security really is about, and the more you're aware, the more you know before you go, the better off you're going to be, and there will be a significant reduction in complications. Okay, so thinking outside the box, you can't anticipate every risk. The best thing you can do is provide full knowledge for your people. I like this slide. That's my son at the National Zoo in Washington, D.C. He decided to stick his head in a statue, and he got stuck for about 20 minutes. It wasn't a fun experience for any of us, and it certainly wasn't one that I had anticipated. I have 6 children, and whenever I take them anywhere, I'm very up on their security. I don't want any of my kids getting lost, so they all wear the same color shirts. That way I don't have to stop and think about who's wearing what. I anticipate other problems, but I certainly did not anticipate, a statue of a dinosaur eating my child's head. And that's going to happen, to all of us as we travel around. We try to anticipate most risks and stay informed, fully informed about the different things that we may encounter on travel, but we can't anticipate everything. And knowing how to reach out to someone who can help assess the situation and help give you more information to mitigate further risks, prevent bad things from happening, or assist you, when you're in the middle of a crisis is very important. And that's why having assistance providers, making sure you have adequate insurance, and getting up to date on all of the current risks and what we call endemic health risks, those that are just natural to a country, is very important. So for 2017, what is IJET looking at? Well, we're looking at some long-term the health issues. And although Zika virus, it's good news that these cases are reduced, we still want organizations to be aware of what Zika is, who is most impacted by, and having plans and policies in place, to mitigate and prevent any threats that this disease might pose to your employees or students as they go around the globe. We're looking at food security and understanding that that is a risk in many areas, both in terms of foodborne pathogens and making sure you cook your food, wash it with clean water. If you're going to eat it raw, and peeling things, to prevent contamination, cross-contamination, and also knowing if you're going to run into a supply problem, with just not having adequate foods depending on where you're going. We're looking at resurgence of vaccine-preventable diseases, so we want everyone to know their immunization status, get immunized properly for protection, because we are seeing a growing population of people refusing these vaccines, and that is going to mean increased diseases that we took for granted were just about gone in the past. We're looking at dementia and aging workforces also as a long-term problem for a lot of companies. What you need to do and what you need to be thinking about in the future. So we'll open it up for any questions. Know that these slides and the recordings will be available for you to go over. And if you can't think of a question now, then certainly, we will be available to answer those, on our corporate website or by contacting health at iJet, and certainly we can on our blog post that we have as well.
All right, thank you so much, Catherine. We did have a couple of questions that I would like to get to from our audience, if they are hanging on the line with us.
Great.
One question that we have here: is there any persuasive research for risk and uncertainty connecting to mental health issues?
Most of the research that has been done surrounding mental health issues, in terms of travelers, is in students. We do know that one of the largest costs of having expats is repatriation unexpectedly, and the number one reason to repatriate somebody is because of mental health challenges. Acculturation, not being able to adapt to a new culture, having family members that are struggling with adaptation to a new culture. I know if I took my 17-year-old, and said, oh, we're moving to a country that has spotty Wi-Fi access, and she didn't have Instagram, at her hands 24 hours a day, I would have a very unhappy child on my hands and probably ask to come home. Because of that. More research really needs to be done on mental health as awareness grows and destigmatization occurs, which is really awesome. There are a lot of countries that just don't have community mental health programs. Some mental illnesses are actually criminalized. And it's very risky. Taking medications abroad is also something we need to be really aware of. A lot of countries, you can't bring medicines for ADHD and ADD into those countries at all, and you're not able to access those. So Ritalin and Adderall prescriptions, Concerta, and other medications that are used in both children and adults to effectively treat these mental health challenges and issues. Some people just can't travel, to some of these countries. And so more research is being done because more medications are now available to treat mental health challenges, depression and anxiety, along with ADD and ADHD. And so we're looking more into those, and I would like very much later this year to have a separate webinar addressing just mental health challenges, especially in the workplace and in universities, because stress and its impact on productivity is pretty significant globally.
Thank you, Catherine. We have an additional question. Are you giving any particular advice concerning MERS-CoV to those traveling to the Middle East or Saudi Arabia?
Absolutely. So over the past few years, since Middle East Respiratory Syndrome, or MERS has been discovered, we've noted that there seems to be a seasonal prevalence of this. We have cases that will rise in the fall and then again in the late spring. And although there's no definitive link yet between camels and human transmission, both of these seasonal variations do coincide with camel herding and camel breeding. So what we recommend for a lot of people who are going to that area is make sure you get your annual flu shot. It's not that your flu vaccine is going to prevent MERS, which is a coronavirus, but it will help doctors kind of pick out whether you've just got seasonal influenza or whether you should be tested for something more significant. And a lot of MERS-CoV outbreaks occur in hospitals. So avoiding hospital stays is very important. People with chronic respiratory problems, or other illnesses, the more you can avoid hospitals in areas where it's endemic, and this is predominantly in the Middle East. We didn't see a lot of spread outside of this region, then the less risk you have of actually contracting the disease. They're called nosocomial infections when hospitals inadvertently transmit a disease from one patient to another. And MERS has definitely been shown to be one of the most prominently. And an outbreak in South Korea, a couple of years ago, South Korea very effectively stamped that outbreak, in its infancy by enforcing very strict infection control policies and preventing the movement of patients, from one ward to another where they might be able to spread the disease. So get your flu vaccine. Don't kiss any camels, and try to stay out of the hospitals is our best advice at the current time until more is known.
All right, great, Catherine. Just a final question coming through here about additional health concerns that you may not have had time to cover in the webinar presentation that you might be also monitoring this year.
Sure. So we've seen spikes in dengue and chikungunya over the past few years. We expect that those are going to be continued diseases of concern. Again, reiterating the yellow fever outbreak that's occurring in Brazil, we have our eye on that. We're monitoring that very closely because yellow fever vaccination is a requirement for a lot of countries, and often when only certified yellow fever clinics are allowed to administer this vaccine. So if people don't go for pre-travel health consultations, to a travel medicine specialist, they may not be adequately vaccinated and risk exposure, and this is a deadly disease. It's also one that other countries don't want. An outbreak in Angola last year, was pretty significant, and then it did spread across a border to the DRC. That is a big risk in non-immune populations and under-vaccinated people. So we're looking at that. Eyes on probably sporadic Ebola outbreaks, here and there, because it did, have a spread throughout Central and Western Africa a few years back. It definitely was contained after a substantial period of time. But again, the animal reservoir for that disease still exists, and so when people come in contact with these animals that do harbor the disease, they risk getting infected and causing small pockets of outbreaks. So that's something that we keep an eye on. Definitely seasonal influenza, which spreads like wildfire throughout populations and causes workplace absences and schools, and norovirus. So norovirus is something that we see every year. Tens of thousands of people are infected with it. It's a very nasty bug, usually only lasts 48 to 72 hours, but is highly, highly contagious. And can cause widespread interruptions. So we keep an eye on that as well.
Thank you, Catherine. We actually did have another question that came in while you were covering the last, asking if you have any recommendations for resources for helping organizations kind of determine that fitness of duty or fitness for duty of employees.
This is with regards to dementia and cognitive impairment, I believe. That specifically, there's a lot of fitness for duty, pre-employment examinations that can be done depending on exactly what the work environment is going to be. In my experience in occupational medicine and health, I would go out to various work sites and see what the physical demands were going to be, and then match that up, with the people who were placed in those positions to determine their fitness for duty. Whether it were firefighters or construction people or people working in some of the chemical farms and things, I would go out and try and walk 3 flights of stairs in personal protective gear in South Carolina heat. Not a lot of fun, but I would then be able to relate that, to people who would come into the organization, that might have some challenges, and then suggest ways to prevent workplace illness and injury. With dementia, and this growing aging workforce, I think we're going to start to see some challenge tests come out. With traumatic brain injury right now, they have very good tests to assess a patient's level of progress throughout the stages of their injury. They're generally memory tests, they're reasoning tests, they're logic tests, and things like that. And that determines, how they're getting better. I see some of these tests probably being consolidated into sort of just a short assessment that workplaces can use, without running a risk of alienated a protected group, no age discrimination or anything, and looking at in their early fitness for duty, just sort of little memory tests and things, and then repeating it, if the results were not what was hoped for in a period of time, say like 30 days, to see if these people were just having an off day, or didn't really feel well and had a problem concentrating, and then continuing to repeat it, much like workplaces administer drug testing, for their employees, and seeing, how if these test scores improve, or if they stay the same, or if they start to decline, and then again having that policy in place, and what do we do about somebody who continues to show declining scores on some of these memory tests? Could it signal cognitive impairment? What are we allowed to do? Can we suggest that they see a doctor? Things like that, working that all out with human resources and legal counsel, and medical, if you have an on-site medical clinic, with a nurse or physician in advance, to be able to kind of screen people.
All right, thank you, Catherine, for that question and answer session. Thank you, everyone, for your time and tuning in today. Today's webinar is part of our monthly webinar series, and you can register for more live webinars and explore our on-demand webinar topics at our website, www.ijet.com/webinars. Be sure to take the brief survey that will pop up when you hop off of this webinar. If you have additional questions about the material we've covered here today, let us know in the survey. And as Catherine also said, you could feel free to email health@ijet.com. Everyone enjoy the rest of your day. Thank you. Bye-bye.
Thank you.